My name is Donald McDonald, and I'm a person thriving in long-term recovery from substance use disorder. What that means is I haven't had to use alcohol or other drugs to face the day in 13 years. I got well, then I got better than well. I am fully present as a husband and father. My family trusts me and they're proud of me. Last year I graduated from a top-ranked social work graduate school. I'm a licensed clinical addiction specialist and a nonprofit leader. I once was considered hopeless, but now I'm part of the solution. We help educate organizations, communities, and families about substance use disorder. We help passage of common sense legislation and the development of person-centered policies. The fact is this: everybody experiencing substance use disorder has the potential to get better than well. 1 in 7 of us have a substance use disorder. Among those, only 1 in 10 have access to specialized treatment. Meanwhile, North Carolina loses a loaded school bus full of citizens each month to prescription opioid overdose alone. We have 5 decades of research supporting the fact that substance use disorder is a chronic brain disorder, not a moral failing. Yet we have been responding to it with the acute care model of addiction treatment. And the more we learn about the pathology of substance use disorder, the fewer resources we have to treat our fellow citizens. This only makes sense in a paradigm where stigma-driven public perception is allowed to evolve into stigma-driven public health policy. We've been fighting stigma for years, and it seems we've begun chipping away at that insidious internalized stigma, that shame that kept us from asking for what we deserve. We've all seen so much death. We've comforted grieving families. And in the midst of this public health crisis we were fighting, we discovered that we were also embroiled in a civil rights struggle. We realized that it was no longer stigma we were fighting, it was discrimination. We saw the nation circle its wagons around Zika and Ebola while mental health and substance use resources did not respond in kind to the very real epidemic that we were experiencing. That's not stigma, that's discrimination. There are 23 million people thriving in recovery in the United States. Our pathways of recovery are just as diverse as we are. But the indisputable fact is this: we got well, then we got better than well. We are resources. We stand ready to continue advocating for additional resources for medical professionals. Many of us have entered into peer professional addiction services. They call us recovery coaches or certified peer support specialists. We encourage you to add these peer-based recovery supports to your menu of services. Reach out to communities of recovery for their support, for their input. We are part of the solution.